time with this microphone. Thank you.
Sorry, I forgot to start the recording, guys.
So yeah, I'll kick
All
it
right.
back. Yeah.
Oh, sorry. What'd you say, Jason?
I was just saying, I'll kick it back over to y'all to take it from here.
All right. Yeah. Thank you. All right. So we're going to get into the nuts and bolts of what we're here to learn about today, which is rescheduling and descheduling. So I am going to turn it over to Kat, and Kat, take it away.
All right, can folks see my screen okay and hear me okay? Excellent. So my name is Kat Packer. I'm the Director of Drug Markets and Legal Regulation for the Drug Policy Alliance. I want to thank Supernova Women and Last Prisoner Project for co-sponsoring this town hall with the Drug Policy Alliance so that we can get into some of the details of federal marijuana scheduling. And before I start the presentation, I just want to let folks know that next Monday, the Drug Policy Alliance is going to be participating in an Instagram Live with SSDP. And so if folks are interested, please follow either SSDP or Drug Policy Alliance on Instagram. This will be next Monday at noon.
I'll work to reform the criminal justice system, improve community policing, decriminalize marijuana, and automatically expunge prior marijuana convictions. I'm Joe Biden, and that's my commitment to you, and I approve this message.
So as we know, back in 2020, when President Biden was running for office, he pledged to both decriminalize and expunge cannabis-related records. And in October of 2022, he made another statement on cannabis policy reform. I'll play a quick clip of that as well.
Criminal records for marijuana possession have led to needless barriers to employment, to housing, to educational opportunities. And that's before you address the racial disparities around who suffers the consequences. While white and black and brown people use marijuana at similar rates, Black and brown people are arrested, prosecuted, and convicted at disproportionately higher rates. So today, I'm taking 3 steps to end this failed approach.
So we'll get into one of those 3 steps, specifically the administrative review process of scheduling at the federal level. But want to just first start by articulating that both Congress and the DEA have the authority to change marijuana status under the Controlled Substances Act. Congress can do that by passing legislation, and the DEA can do that through this process known as the administrative review process. And that's what the bulk of my presentation will cover today. So just as a revisit of the timeline, back in October of 2022, President Biden issued the statement where he issued pardons for simple possession. He encouraged governors and states to do the same, and he called for this administrative review. We've since learned from then that the Department of Health and Human Services, HHS, has recommended that marijuana be moved to Schedule 3. As recently as December of last year, the DEA shared a letter to a member of Congress confirming that it has the final authority on this particular decision and that it was conducting its review. And then in January, in response to a public records request, the Department of Health and Human Services ultimately released its recommendation to the public. And so folks have had an opportunity to look at that. I'll walk folks through a high-level summary of what's in that document. But this is just to kind of walk folks through then to now. We'll jump into some of the specifics, some background that I hope folks have a better understanding of what's moving at the federal level. So for today's presentation, what I'd like to focus specifically on is background information about the Controlled Substances Act. This is the law that is going to guide how marijuana is handled at the federal level, so long as it's a controlled substance. It's also this particular federal law that specifies the process that different agencies have to go through to review how marijuana is categorized under federal law. So we'll spend a little bit of time talking about the Controlled Substances Act. As a part of that, we'll look at the different criteria that federal agencies are considering. We'll spend time looking specifically at 2 agencies and their roles in the scheduling review process, specifically HHS, the Department of Health and Human Services, and the DEA. And then after we look at the agencies and their respective roles in the process for rescheduling or descheduling cannabis, I'll then shift into talking through some of the real life and practical consequences and limitations, particularly of moving marijuana to Schedule 3. So as background about the Controlled Substances Act, substances become subject to the control of the Controlled Substances Act by placement in one of 5 schedules. The CSA is enforced and administered by the DEA, and it requires anyone who handles a controlled substance, literally kind of touches a controlled substance, to register with the DEA and follow DEA regulations. And it imposes criminal penalties for unauthorized activity. It also establishes a process by which substances can be added to the schedule, known as scheduling, move from one schedule to another, known as rescheduling, or descheduling, which refers to removing a substance entirely from the authority of the Controlled Substances Act and the DEA's regulation. Also important to know that marijuana has been a Schedule 1 substance on the Controlled Substances Act since the law was first implemented in 1971. So we'll look at the review process, first looking at HHS and the DEA. And it's important to know that these agencies have their own review process. Mentioned that HHS has completed its analysis and provided its recommendation. But ultimately, the DEA has to do a similar analysis of its own, where they're considering the HHS analysis, but they are conducting their own analysis. And ultimately, it's the DEA that's the agency that's making a final determination. So in figuring out where particular substances are supposed to be placed, the Controlled Substances Act specifies specific criteria that the federal agencies are supposed to consider when placing a substance. Specifically for Schedule 1 drugs, they have to find that the drug has a high abuse potential, that there's not a currently accepted medical use, and that there is a lack of safety for use under medical supervision. For a Schedule 3 drug, in order to categorize a substance in Schedule 3, they would have to find that that particular substance had an abuse potential that was less than Schedule 1 and Schedule 2 drugs. They'd have to find that there is currently accepted medical use, and the safety and dependence profile has to be moderate to low. But there are different criteria for different schedules. And so agencies are essentially trying to figure out where to place things based on this rubric that's established in the CSA. There are several factors that the agencies have to consider when making their findings. There are essentially 8 different considerations, and ultimately, after considering these 8 factors, they have to make 3 different findings. Some of the factors that are included are its actual or relative abuse potential, the history and current pattern of abuse, what, if any, risk there is to the public. And then once they consider all these factors, they're then again figuring out what's the abuse potential. Is there currently accepted medical use? What is the drug's safety profile? And then based on those findings, they can then fit it into that rubric that we had looked at previously. So again, just zooming in on what the specific findings are. We're looking at abuse potential, currently accepted medical use and safety independence profile. And in the HHS analysis that was recently completed, you'll see here the kind of cover letter that was sent along with the HHS analysis. And in this analysis and cover letter, it articulates that marijuana meets the findings for control in Schedule 3, because it has been found to have an abuse potential less than Schedule 1 and 2 drugs, have a currently accepted medical use, and have this abuse and liability profile. It's moderate to low. What I want to spend a little bit of time just zooming in on is this concept of currently accepted medical use, because it's this particular finding and analysis that changed in this particular HHS review, in this particular review of how marijuana is scheduled, that allowed for HHS to come to a different conclusion than it has over the course of the past 50 years. So this concept of currently accepted medical use, again, is one of 3 findings that the agencies have to make. For the purpose of this analysis, the test that HHS used for currently accepted medical use was a new one. It used a 2-part test. The first part considered whether there was widespread current experience with medical use of marijuana in the United States by licensed healthcare practitioners. The second part considered whether there was some credible scientific support for at least one of the medical conditions for which the Part 1 test is satisfied. So I'll quickly kind of go through what some of these elements are. So for this Part 1 test, part of what HHS found is that they found that there were 30,000 healthcare practitioners that were recommending marijuana to over 6 million registered patients across the United States, specifically for 15 medical conditions. And using this new test, HHS found that that constituted widespread clinical experience. And so they met that Part 1 test. For the Part 2 test, there's a consideration of whether or not there exists some credible scientific evidence for at least one of the medical conditions. I'd mentioned previously that they had identified that there were 15 medical conditions across the United States where medical use was being recommended. In this particular analysis, they only looked at 7 of those medical indications. Of the 7 medical indications that they looked at, they only found credible scientific support for 4 of those conditions, specifically anorexia related to a medical condition, nausea and vomiting, and pain. But their test, the second part of their test, only require that they meet one or find that there be some credible scientific support for one of the medical conditions, and they found 4. So they've been able to meet Part 2 of their new test. What's notable about this, and I'll just share a couple quick notes in my analysis of the HHS review. It's 252 pages. So if you're ever really interested in doing a deep dive, but just want to give you some of my highlights. What I found most notable about this new test, right, is that it's new. This 2-part test in previous reviews of marijuana's status under the Controlled Substances Act, HHS and DEA had used a 5-part test. This had been part of the challenge and obstacle that marijuana had experienced in trying to move from one schedule to another. Folks said that the 5-part test that the HHS and DEA used in the past mirrored FDA approval, and marijuana has not been approved by the FDA. And so folks would say that marijuana would have never met this standard that mirrored FDA approval. But with a new test, we don't have that obstacle anymore. But this new 2-part test, a departure from the past 5-part test, is really the centerpiece of this new analysis. The other thing that I want to point out for these stakeholders who are on this call, particularly because I know that you all are the type of folks who are concerned about efforts to acknowledge and address the harms of cannabis criminalization, particularly against Black and Brown communities. One of the factors that HHS has to consider when making its evaluation is the history and current pattern of abuse. And part of what they consider and looking at the history and current pattern of abuse is the federal history of marijuana control, essentially looking at the history of federal criminalization. And what I found to be quite frequently egregious was the fact that HHS and FDA had the audacity to name Harry Anslinger, who we know was racist and responsible for cannabis criminalization, particularly in trying to harm Black and brown communities, cite him in their analysis as a part of history, but failed to mention the racist origins of history and his contributions to federal cannabis criminalization. Similarly, the HHS analysis and its consideration of the federal history of marijuana control references the CSA. It doesn't necessarily name Nixon, which I think is problematic as well, because we know that Nixon signed the CSA, and it was later revealed that his explicit intention in placing marijuana under the control of the CSA was to disrupt Black and brown communities. The history of federal control in HHS also fails to mention the fact that marijuana's placement as a Schedule I substance back in the day was originally meant to be temporary until a report came back from a commission that was called the National Commission on Marijuana and Drug Abuse, or the Schaefer Commission. This was a commission that was appointed by President Nixon himself. This commission recommended that marijuana be decriminalized explicitly for personal use, and Nixon disregarded his commission's recommendation, and this history is missing from HHS's accounting of the federal history of cannabis control. Another note, I talked about the things I don't like about the analysis. One of the things that I do like about the analysis is that there are so many different ways that this analysis makes clear that alcohol is much more dangerous than cannabis. It was used as a comparator in this particular analysis, meaning it was one of the drugs that marijuana was compared against and trying to figure out its relative abuse potential, liability potential, et cetera. They found that marijuana had alcohol had higher rates of adverse outcomes, abuse liability, poison center cases, hospitalizations, overdoses, et cetera. So we talked about HHS. I'm going to quickly talk about the DEA. So the DEA is next up. They're doing their analysis right now. And the expectation is that this essentially could go one of two ways. And in reality, it could go more than these ways. But if they're moving to a Schedule 3 decision, I imagine this will go one of two ways. We'll either get a proposed rule. If we get a proposed rule, there'd be an opportunity for public comment. There could be public hearings before a final order. Or we could just get a final order from the DEA. One of the things that might allow for, that would allow for the DEA to issue a final order is that there's a specific kind of provision in the CSA that says that if marijuana is subject to the control of international drug control treaties, then the Attorney General can suspend its normal rulemaking process and place the substance in the schedule that they deem most appropriate. So we'll see what becomes of that. But DPA has been operating, or at least planning and preparing for a public comment period and trying to encourage folks to get ready for that public comment period, because it would be an important opportunity for stakeholders to voice their opinion, specifically to call for decriminalization and descheduling. We've been working with the coalition United for Marijuana Decriminalization to urge participation in the potential upcoming public comment process. We've created an API tool to help folks send public comments once and if a public comment period begins. This tool will be available at deschedulemarijuana.com. If there is a proposed rule, it would be published in the Federal Register. This is essentially what it would look like. It would include different information about the proposed rule, about the public comment period, if there were deadlines to request a public hearing. It would provide legal authority and background in the DEA making its decision. It would articulate whatever its decision was, walk through its factors. And then it is also going to not just be Schedule 3, there are going to be rules or regulations that are associated with this move as well. When the DEA schedules substances, reschedules substances, they also publish these requirements for handling. I had mentioned that if you're handling marijuana, you need to register with the DEA, and so it would articulate the different requirements for different entities that were handling marijuana who wanted to do so legally. We'll talk about like who that actually applies to. So I want to shift into talking about the actual consequences and limitations of Schedule 3. First and foremost, this is kind of a categorical change in the schedule. So marijuana will be categorically thought of as a substance that has currently accepted medical use and abuse potential that is less than Schedule 1 and Schedule 2 drugs and moderate to low safety and dependence profile. It's also widely been reported that the marijuana industry would receive tax relief in the form of relief from a provision known as IRS Code 280E, which specifies that businesses can't make normal business deductions if they're engaged in business associated with Schedule 1 or Schedule 2 substances. So a move to Schedule 3 would mean that those particular provisions would no longer apply. And then I want to shift into this concept that I've created to try and help folks understand what Schedule 3 means and for who, that I've been referring to as the 5 Ps of rescheduling marijuana to Schedule 3. So the Ps are producers, products, prescriptions, patients, and penalties, and I'll walk through these in sequence. So producers, as I mentioned, anyone who handles marijuana needs to register with the DEA. So if you're a producer, if you're in the industry, right now, if you're a researcher, manufacturer, distributor, medical professional, you want to handle marijuana, you need to register with the DEA and follow DEA regulations. Only entities who are registered with the DEA are going to be able to lawfully handle marijuana under a Schedule 3 situation. Any entity that is handling DEA or handling marijuana without a DEA registration or not in compliance with the CSA would remain illegal under federal law. The second P is products. So the FDA has the authority to regulate products containing cannabis and cannabis-derived compounds under existing federal law. This is a different law, not the Controlled Substances Act, but the Food, Drug, and Cosmetics Act. The FDA has approved cannabis-derived drugs and cannabis-related drugs, but marijuana itself is not an approved product. This means that the FDA has not taken, any botanical whole plant product, any of the products that are on the shelves in adult use or medical markets through any type of formal pharmaceutical approval process, and that is primarily what's required for products to be lawfully approved, particularly for interstate commerce. I know folks will say, well, maybe it doesn't matter because I'm engaged in intrastate commerce. We'll just note for the moment at least that the lines of interstate commerce and intrastate commerce are blurry and undefined at this point in the cannabis space and generally. The next P, prescriptions, but it also you can think of prescribers. If you are a medical professional that is working with a controlled substance, you're handling it, you need to register with the DEA and follow DEA regulations. But it's important for folks to remember that, if you think about a pharmaceutical product or FDA approved drug, the only people who are able to use those pharmaceutical products are individuals with valid prescriptions. And so even if there was a substance, for example, that was FDA approved, if you were a person that was using that product without a prescription and that was required, that could be and would be considered illegal under federal law as well. So accessing marijuana through other means, such as through state regulated programs, whether they be medical or adult use, would remain illegal under federal law. Similarly, kind of following that same logic, you know, the only individuals who would be considered to be lawful medical marijuana patients under federal law, under a rescheduling decision to Schedule 3, are those who are using lawful products pursuant to a prescription. And remember, none of those products exist to date. And even when they do, you'd need a prescription. So a move to Schedule 3 is not going to facilitate access to medical cannabis. It's not going to protect any medical cannabis patients as they're kind of defined at the state level today. And then the last P is penalties, because again, anyone who's engaged in activity that falls outside of the confines of the Controlled Substances Act, not the confines of Schedule 3, but or Schedule 1, but the confines of the Controlled Substances Act, are subject to criminal penalties. The only way to remove criminal penalties under the Controlled Substances Act for cannabis is to remove marijuana from the Controlled Substances Act and to deschedule it. Part of the reason why this is the case is because marijuana is kind of unique in the CSA. There are certain drugs on the Controlled Substances Act where the penalty is schedule specific. So, you know, there are Schedule 1 penalties, Schedule 3 penalties, etc. Marijuana has marijuana specific penalties under the CSA. So it doesn't matter if it's Schedule 1, Schedule 3, Schedule 5, the marijuana specific penalties are going to apply no matter what, so long as marijuana is a controlled substance. Just as a quick reminder, federal law makes no distinction between medical programs and adult use programs at the state level. So, you know, I know I've heard a lot of rhetoric from folks like, well, maybe state medical programs will be protected. That's not the case. Federal law considers them to be equally illegal. Also, just want to reiterate, and I think there's been a lot of confusion around this rhetoric around currently accepted medical use. Folks say, well, if there's currently accepted medical use, doesn't that mean lawful federal use, legal federal medical marijuana, something like that? No. Currently accepted medical use is a specific term that's used in the scheduling process that describes one of 3 findings that are needed for a drug to be moved from one category to another. It is not the same as FDA approval. And again, FDA has approved certain cannabis derived and cannabis related products, and even those products are only available with a prescription from a licensed healthcare provider. A lot of folks have asked, well, how does scheduling impact DEA and FDA authority? The reality is that a move to Schedule 3 would not impact either DEA or FDA's authority. FDA currently has authority over cannabis in regulatory sense under the Food, Drug, and Cosmetics Act. The DEA currently has authority over cannabis under the Controlled Substances Act. As a Schedule 1 drug, the DEA has been the primary authority over cannabis, but it is not the case that the DEA is going to be out of the business of cannabis if marijuana moves to Schedule 3. So the authority doesn't change at all. What is unknown is how this change is going to impact how both the FDA and the DEA utilize their authority, but the authority itself doesn't change. What would change is if marijuana were descheduled, it would remove marijuana from the authority of the DEA because it would remove it from the Controlled Substances Act, which the DEA is responsible for enforcing and administering. Legislation can do whatever it wants. Legislation could make the DEA responsible. Legislation could make the FDA responsible. Legislation could create an entirely new federal agency to be responsible to criminalize, establish, home grow, protect patients, tribes, etc. Lots of opportunity with legislation, but mechanically, the legal authority of the DEA and the FDA will not change under a rescheduling decision, primarily because rescheduling is not a legal change, it's a regulatory change. So to decriminalize marijuana, it must be descheduled, completely removed from the Controlled Substances Act. Rescheduling would not end marijuana arrests. It wouldn't release anyone in prison. It wouldn't restore access to public benefits, protect anyone in state legalized marijuana programs, workers in the legal cannabis industry. It would not right the wrongs of racially discriminatory enforcement. Under a rescheduling decision, we'd still be dealing with criminal penalties, racial disparities, discrimination in housing, employment, education, healthcare, dealing with state and local medical and adult use programs that are in conflict with federal laws, a status quo where folks are being deported for cannabis, and where cannabis is impacting immigration and visa status, where it compromises individuals' Second Amendment rights, access to participate in the military or get military benefits. And under a rescheduling decision, because the cannabis industry is still just as illegal as it was in Schedule I, folks are still going to struggle to have access to banking, primarily because it's the illegality of their engagement with cannabis businesses that could potentially compromise money laundering laws. So for this reason, it's been our position, the position of our allies and partners, that rescheduling marijuana to Schedule III isn't enough. You can help by educating your community on the consequences and limitations of rescheduling marijuana. There's a public comment process. Participate and support federal marijuana decriminalization. Encourage other folks to support. I'd ask you to follow and support the work of the Drug Policy Alliance and United for Marijuana Decriminalization. We have lots of great resources on our website. You can find our website at deschedulemarijuana.com. United for Marijuana Decriminalization, it's not only Drug Policy Alliance, NCIA, BOLPAC, Minorities, MCBA, Parabola Center, NABCL, and Marijuana Justice are also our coalition partners in United for Marijuana Decrim. You can find more information about this coalition and our efforts to call on the Biden administration to take further action at decriminalizemarijuana.com. I'd also encourage folks to check out press conference that DPA recently led. Amber, Supernova Women participated in this effort. We're focused on the impact, particularly on communities of color. And that is the end of my presentation. So I'll hand it back over to you, Amber.
Excellent. Thank you very much. Thank you, Kat. I'm going to go ahead and share that image again for the sign-on letter, and want to encourage folks to please sign the sign-on letter. And looks like we got a couple of questions here in the Q&A. Okay, so this question is from Lauren Wyatt. Some say advocating for descheduling is extreme and that we should settle for incremental progress. What's a polite way to respond to that? Anybody want to take that on?
We're fighting for the end of criminalization. We're trying to make sure that we do this in a way that acknowledges and addresses individuals who have been most harmed. And what I try to remind folks is that the actions that the Biden administration is taking shouldn't change our position. You know, there are folks who supported decriminalization, longstanding supporters of decriminalization, of adult use, of legalization, who are compromising their position to give Biden political cover. And, you know, I like to articulate, like, I planted my flag in the ground. It's not for me to retreat because our leaders aren't where we are. We need our leaders to meet us where we are. We're at a point where over 70% of Americans support legalization, where 24 states have passed adult use cannabis. Majorities of both parties support legalization. This is not extreme. This is democratic.
Yeah, I mean, I would go on to say that the states have done more than what this already proposes. Like the states have already decriminalized and legalized in some places. So if the states have gone farther than what the feds are just proposing, like that's a natural rebuttal in my opinion.
Yeah, and I'll just say that the president himself promised to do it. And so it's not an extreme position to hold the president to his promises during an election year. Like, this is exactly the time to do it. And we should always be advocating for what we actually want. Like, let the government, try to push back on us on what we want. But there's no reason to cede that ground right from the get-go. And if anything, this is long overdue. And I think the vast majority of the country knows it's long overdue. And so this is as moderate of a position that exists in politics today. It's the highest supported issue in politics. It's smart politics for, if you do care about folks wanting to win, the parties that come out strong on this issue are going to gain votes. So it's not just the time has come for this issue, but it's politically smart for them to get behind it. If they're serious about actually winning the election, this is one issue where they can get a lot of votes very quickly with not that much political capital expended. The president himself can do a lot immediately to advance this issue. And then every congressperson is up for re-election this year. Every congressperson in California is up for re-election this year. And we all know that none of the big things that we want are going to happen until federal legalization finally falls. And we have the political momentum. So now is exactly the time to do it. And we should just always ask for what we actually want.
Ask for what you want. All right. Any other questions? Got some nice comments in there. Thank you for the great information. Thank you, LeVar. And Lauren Gibbs says, wow, that was excellent. Great job. All right. Well, if there are no further questions, we are going to conclude today. Again, please make sure that you scan this QR code and go ahead and sign that letter. As well as if you are in California, please consider coming to the press conference next Wednesday at noon, downtown Oakland at Oakland City Hall. We'll have a number of different representatives speaking, some folks from the industry, some folks from the nonprofit community, as well as some celebrities. So pretty awesome. And would love to see you all down there. Oh, we've got one more question from Lauren Gibbs. Sounds like the DEA has vested interest in Scheduling 3. Do you all agree, Kat and Jason?
I think that the DEA has a vested interest in continuing the war on drugs. And so this is where they think they have to cede a little ground because the public pressure has been building so much. And so I'm sure they have the vested interest in doing as little as humanly possible. The other thing with like the DEA and rescheduling is we have no idea when it would happen or how long it would take. So the DEA also has a vested interest in just delaying this entire process as long as possible. And so we have to make sure that the urgency for full legalization is there so that the DEA's vested interest is not as important as the political pressure that we put. But I basically agree with the sentiment.
All right. Well, thank you everybody for joining us. That wraps up our session right at 4:20. So, yep.
Nice.
Here's
Well
everybody.
done.
And
All right.
we hope,
Next week in Oakland.
yeah, see you next week, downtown Oakland at noon sharp. Thanks, everybody.
Take care. Peace.